Well, thank you very much for that introduction, Claire. That was so lovely. And thank you so much for having me here today. This is actually my debut presentation for Respect Victoria. I joined the organisation in February of this year, having come from far north Queensland, where I've been working on Cape York and internationally for the last 10 years. I am originally a Victorian, so it has been a lovely homecoming. So I've been very warmly welcomed. I was asked today to talk to these three questions, which I think are absolutely enormous questions. And my response was actually, this is probably the presentation I'd like to give in about 12 months from now. But I hope to be able to give some insight into these questions through the context of Respect Victoria, where we're working. Before I do so, I'd really like to pay my own acknowledgements to the traditional owners of the land in which we're meeting here today, and to their elders, past, present and emerging. And I'd also like to pay respects, my deep and profound respects, to the victim survivors and dedicated advocates of this work, people who have worked an entire lifetime of ours before ours, working to prevent violence against women and their children. So who is Respect Victoria? Some in the room will be familiar with our organisation, some may be less so. So we're a statutory authority that is dedicated to the primary prevention of all forms of family violence and violence against women. We're established in October, and we're an outcome of the Royal Commission into Family Violence. Our focus is on stopping violence before it starts by changing the culture that allows this to happen. We have a strategic plan, which some of you may or may not have seen, and we have 5 pillars of activity that we have been developing business plans and subsequent work around. The 2 that are of significance to my team is Pillar 1 and 3, leading the research agenda and the development of our research program, and also how that is taken up by the communities for best effect. But the work that we do in our team actually is cross-cutting across the organisation, so we have influence in all 5 pillars. In my presentation today, I'm going to completely avoid talking about the work that we do in our communication and engagement team, because there's a whole swathe of projects that they're doing. You may have seen TV ads. We had an elders abuse campaign launched on Friday, but because I really don't have a lot of time, I'm going to focus on the work that I'm responsible for with my wonderful team. So we are dedicated to prevention through a primary approach. So we see this approach as being a long-term agenda. We do not expect to see results in any short-term way, although we are definitely building on the very good work that has already been done by others. So we look forward to starting to see that impact. We are interested in identifying the underlying causes and drivers of violence. We're focusing on changing social norms, practices and structures that influence right down to the individual level. But we are, of course, working at the societal and community levels. We take a holistic approach, so we see primary prevention as both distinct but complementary to work that's done in the tertiary and early intervention spaces as well. And we also believe that this is the way to reduce overall prevalence of violence in our society. So coming back to one of those questions, the overlaps and divergences between violence against women and family violence. This is best addressed perhaps by thinking about what our function is. We undertake and procure and disseminate research. We are around awareness raising in the community through programs, activities, campaigns. We also provide advice to the Minister, particularly around what decision-making, funding, policy settings should be tweaked in order to make the best use of the research and evaluation findings that we produce. Having said that, we monitor and evaluate, and in the future, we are looking towards having some endorsement model that will be implemented so that we can recognise what very good programmatic work is happening and how that can be scaled up to best effect across the sector, across Victoria, potentially beyond for all of Australia. And our role is also to report on trends in family violence. So we really want to build on the good work that has been done, and we recognise the gendered nature of violence against women, and we want to build on that as we expand out to thinking more about family violence and how that gendered drivers may apply and then beyond. So in doing this, we're looking to be more inclusive in our work by taking that family violence approach that involves thinking about how violence against women and family violence might intersect, what effects the intersection of diverse identities has on the incidence of violence. So we're very interested in intersectionality, and we're developing an intersectionality approach for the organisation, a policy setting. Perhaps it will be a framework or guideline or set of principles. Not so sure how that's going to shape up yet, but it is going to be very influential and important in how we do and carry out our work, and what this means for effective primary prevention efforts across the sectors as well. So we are faced by a number of challenges as well, and one of those is around our language that we use when we think about family violence. And it was probably fair to say that even inside Respect Victoria, sometimes we hear differences of view about what family violence is. So we need to generate an understanding, because at the moment these understandings differ between practitioners, academics, across disciplines themselves, and then when we're actually speaking to families and family members, as you probably well know and understand. And we're also challenged by what you said so well, Claire, the evidence base. We need to generate a raft of primary research, and that is part of our remit, is to commission work, to start that ball rolling and to build on the evidence bases that we have, so we can build evidence-informed and evidence-based programmatic work. So some of the work that we are doing, this is just a snapshot, but 2 research projects that we are in the process of commissioning right now. One of these is around LGBTI work. We are partnering with Drummond Street Services with this project. It's very much geared towards understanding what drivers there are behind family violence in these sectors, how family violence and the drivers are conceptualised, and how we can safely and securely engage with LGBTI people to have conversations around family violence, what that might look like, and how we can intervene and build really strengths-based approaches to mitigating and dealing with prevention, or from a prevention perspective. And another example that we're about to commission is work around older Victorians. This is a space where there are so many gaps in our knowledge and understanding. So we need, again, to do some work that's going to start to uncover the drivers and dynamics of violence in this space. For these 2 projects, we're taking an action research approach, because we feel that the grounded approach is a good way to start to build this evidence base. Other work that we're doing in our area is around evaluation. So we're starting working with the Office for Women in partnership, looking at the Free from Violence Monitoring and Evaluation framework that has funded over 130 programs across Victoria. And then there's monitoring change. This is a far more long-term project, but we are developing a data platform that will be hosted by the Crime Statistics Agency. It's a framework for monitoring change at the population level over time, to see what efforts, what we can really learn about prevention from all our combined effort. So our work is to coordinate and collaborate to strengthen primary prevention across government, industry, organisations and communities. And we want to be spread wide. We want to go to non-traditional sectors. We want to be inclusive. We are very keen to hear and listen to the voices of people that matter, lived experience, and in settings that we might not yet have unpacked, some of which may or may not have been uncovered by the Royal Commission. What we would also seek to do is to scale up evidence-based practices that are shown to be effective. And to do this, we seek partnerships with organisations, agencies, individuals. We are very conscious that this is not work that we can do, but it's what we all can do together. Our role is to partner and to be embedded in this sector, in these communities, and to understand the work that you do well so that we can really promote and advocate on people's behalves and organisations' behalves. So please do have a look at our website if you're not familiar with the work of Respect Victoria. It does give you more information and we're constantly building on that. And I'll be around for a bit longer too to take any questions that you might have about us. So thank you very much. Here you go.
Anne has been incredibly succinct and gone a little bit under time, and we feel it probably slightly too early to send you to morning tea. So we're actually going to do some questions with Anne now. So if you've got any burning questions that you'd like to ask, we will put that on. And I guess I've got one to start us off. So, Anne, you've talked about how keen Respect Victoria are to, I guess, engage with people and for partnerships. What are some of the opportunities at the moment for people to start to engage with you? What could that look like?
Thank you, Claire. What we are doing is commissioning research, so we will be advertising tender opportunities. We've had a few out there and we're about to put one out into the market around research with people with women with disabilities, for example. So these are opportunities that will arise from time to time. I'd also say too that Respect Victoria is in a growth stage, so we're still recruiting staff. I just onboarded someone on Tuesday who's joined us, and these opportunities will continue to arise as well. So there are different ways to engage through commissioned work, and joining the team. But beyond that too, we are really looking to building our research alliance and our alliance of prevention practitioners. And so there's the opportunity to come together for particular events. Things that I see coming down the track that I will be responsible for include the development of our research agenda. This needs to be informed by practitioners. We want to know what are the priorities and needs for research, given it is a limited dollar too that we have to spend. So what is the best place for that dollar to go? We also have a theory of change, a narrative that we're building around what this work looks like for Respect Victoria and for our sector, and that can't be done without consulting with you, engaging with you, understanding what your views are around this work and how we then can articulate that to communicate to the wider Victorian community.
And Anne, I know that, can people hear me? Is this on? Yeah. I know that, that the sector, there's so much work happening at the moment. A lot of people are doing their own research and evaluation of things that they're doing. Are you really keen for people to get in touch and
Definitely.
say...
Yes, definitely. So I also see the development of the Free from Violence Monitoring and Evaluation Framework as something that we might be able to expand out in later years and to encompass a methodology and particular methods for evaluating practices that we see that might be both promising and already really strongly evidence-informed. We need to build that understanding of what's happening across the sector so that we can do that, particularly that first role to coordinate and collaborate across the sector, so we can help be a voice, we can help advocate, and we can help be a partner in getting our needs heard at the senior levels of government, as well as being able to inform each other through networking about what's working and what we might scale up and what you might be able to adapt, etc., etc. So there's a lot of conversations that we can have together, and that we will facilitate opportunities for that in the future.
Fantastic. So we're really keen to hear from the audience. Has anyone got any questions they'd like to put to Anne at this point?
Oh, good. It's nothing like a dead room.
My question is deliberately provocative, actually. What access do you have to government data, particularly the Commonwealth government?
Oh, that's a great question. In the development of our data platform, we will be accessing various different data series. Some of it might have to be paid for, and some of it will be given to us. And that's a place where we would test that question. Our relationship with the government, the federal government at the moment, being a newly established one, or sort of newly established, re-establishing itself, is in its infancy at the moment. And also we've only been around since October, but we already have had some input into the 4th Action Plan, for example, so we're involved in those conversations at the Commonwealth level.
Okay, given that you're so new and you've got enough on your plate to worry about, but just some food for thought for future planning. I work with refugees and asylum seekers. I'm particularly interested in the asylum seeker data that's hidden from us service providers.
Right.
And also the other new migrants that come under the sponsor visas and arranged marriage and all those numbers. We don't have the figures, but we see the end result, where the relationship has broken down and the woman is then needing services to support her.
Yeah.
That's the data that's lacking.
Yeah.
And that's a very vulnerable group that has the uncertainty of whether they are going to be allowed to stay in Australia or they have to be deported, and there's all that kind of stuff that's going on. So it's very hard to develop anything for that group because we really don't have the figures to see.
Yeah. Thank you for that. That's a really interesting space. And I'd love to get your card and we could carry that conversation on later if you like.
Yeah, okay, thanks.
Yeah, thank you. That's really important. And I also take it as a question on notice because I'm not quite sure how we would deal with that, uncovering data like that from the Commonwealth, but it's certainly a space that we would be interested in knowing more about. Yeah.
Did you release the data after pushing and shoving stuff? But it's never the data that you require
Yeah.
to develop a program to justify
Yeah.
the cost.
Yeah.
So that's hidden stuff that we know nothing about, but we see the end result.
Yeah, thanks.
My question is around thinking through evaluation, and you mentioned that you're taking an action research approach to the looking at elder Australians and LGBTIQ Australians, and then I'm thinking about the data platform that you're developing, and I guess, are you looking into ways of how we capture data that might be coming from more of an action research approach and complex change into those more structured? Yeah, how do we, when we want to say action research is often might be the best for primary prevention, a lot of this work, and yet how does that fit into data sets and sort of larger platforms?
Okay, so I guess we take a mixed methodology approach and looking at the best method for the particular question that we're seeking to address. So the action research tranche of projects is around trying to uncover what the current state of evidence is through systematic literature review, followed by looking at the social and local context in which the organisation and the research team are embedded, and their cohort that they want to address, and they're developing an intervention that can be piloted over a 12-month process, or time frame, sorry, and using action research to constantly evaluate and understand what is happening in that intervention. So that's the kind of model that we're looking at with the use of action research for primary research activity. When it comes to something like the data platform, that's establishing a framework, bringing in established data sets from various different collection methods that already exist. Then looking at what those gaps are, and maybe looking at what we need to establish in order to further our understanding. So whether we need to be developing new instruments and tools that would be survey-based, and how we would go about developing those and developing their validity, et cetera, that's quite a long process. So the data platform is probably not something that is really going to deliver really insightful picture of change for some time to come. But it needs to be established now, so that's where we're at. And I think it's a really exciting project because the opportunities for it to be developed, to be nuanced and tweaked for prevention is quite unique. And we're not sure of anything quite like this anywhere else in the world.
No, it is exciting. And
Yeah.
and thinking of Victoria's framework that they're working on building in their evaluation framework, and that we want our projects to be speaking to that framework, but thinking through that where...
Yeah, and how do they all connect?
How does a creative and dynamic process to evaluation that comes through action research and feminist evaluation meet up with a structured framework and the disconnect that could arise between the two? And if and when Respect Victoria is asking those questions about how those can talk to each other, it's really interesting for those of us doing that kind of evaluation.
No, I really do hear what you're saying. I think probably that some of those conversations are going to get very real for us in about 3 or 4 years' time from now.
Thanks very much. My name is Nomini Fernando. I'm a practice-based scholar from Wire. I've just got 2 things to add, just to add a little bit to Ambi's comment about, we're talking about intersectionality and, the book, all the men are black and all the women are white. In Australia, the asylum-seeking women are never seen. Yeah. And I think that's a very important thing. And, we have, like, the UN feminist agenda that says, like, women from conflict and different zones, but those are the women that are completely invisible in research and practice here. So I think that's a very important question. Having to penetrate the ministry of Peter Dutton and the secret, it's quite tricky business, but we never see women asylum seekers in any public material anywhere. Second point is about what my colleague just brought up there. I think in relation to yesterday's comments about that all structures in Australia are colonial structures, and sort of looking back at the research agenda to see how the feminist and gender research is actually addressing the fact that all our structures are colonial structures. Does that make sense? Because what I'm really seeing is like a separation between like women of colour stuff and Indigenous feminist stuff and, white women feminist stuff. And in a way, all of us need to look back on that. And so I'm just wondering, in terms of methodology and so on, are we looking at decolonial methodologies in family violence?
I would say yes, that's what we would be expecting from our providers, our research providers. We'd be looking for approaches that are grounded, that draw on lived experience, that produce strengths-based responses to problems that are identified, sets of recommendations that are realistic, can be acted on, that make feasible recommendations for future work. So we're continually building, and that take into account the work that has been done. I don't think what we want to do necessarily is fall into a positivist research framework. which would silo and isolate different pieces of activity from each other. I'm a systems thinker. Like, I have a PhD in systems theory, and that informs everything that I do. I'm constantly looking for the whole. How does this connect? How does this speak to? How does this relate? And what are the interconnections that we need to then drive, because they also present leverage points for effectiveness and impact.
I totally understand, because I'm also a systems thinker, but from the other side, I suppose I'm a post-colonial feminist methodologist and theorist. Now, what I'm talking about is those very systems that we are using.
Yeah.
How are we decolonialising them? I won't say decolonise, because that's about land, but also in practice. I mean, it's got to be all the way through, not just the research, but it's got to be practices, research practices, and also funding practices. We talked a lot yesterday about funding. And what I find is that the smaller organisations who have to compete for these tenders get overwritten, and then things get decided somewhere. Then we get invited to come to consultancies. And so all that practice expertise, it's the procedure, the process of funding that actually eliminates, a lot of small organisations who are actually experts in the field.
Yes. We are working with the limitations of being a government agency too, so...
That's good to put it right out there. Thank you.
All right, we may have time for just one more question. And Anne will also be joining the panel later on today.
Hi, my name's Melanie Yost. I'm from Seniors Rights Victoria. I just wondered if you could talk a little bit more about the action research project that you're doing with older people and what that will look like.
Do you know, I'm really limited with what I can say right now, because we got our response for quote only yesterday, and I haven't had a chance to look at it in any great depth. So, and we haven't signed a contract yet, which we do hope to do so in the incoming days. So could I get your card? Could we catch up at a later time? Because once some of those bureaucratic hurdles and my own time hurdles are overcome, we'd be really happy to sit down and talk to you about what we're doing. Absolutely.